Hello, everybody. Welcome. Today, I wanted to talk. I've got something on my phone here. Whoops. Hello. Welcome. Today, I wanted to dive into everything insulin resistance. For those of you who don't know me, my name is Dr. Brianne Callanan. I'm a naturopathic and functional medicine doctor, and my goal in working with patients is to help individuals get to the root cause of their health concerns. So a lot of the things that I do in my practice are related to metabolic health, weight loss resistance, hormone-related concerns, thyroid, cortisol. And in this video, I wanted to take an opportunity. If anybody has any questions or concerns that they have, I'm happy to try to address them to the best of my abilities. Of course, I cannot provide individual medical advice on a platform like this, but if there are some suggestions and things that you can utilize, I'm happy to help. So if you wanted to post any of the questions that you have as we go along, I do have some information on insulin resistance and hormone-related concerns that I'll just keep talking and rambling on, but if there's any specific questions, feel free to post them in the comments. The goal of functional medicine is to ensure that individuals, number one, are preventing disease from occurring in the future. So I do a lot of preventative medicine. We have a look at complex blood work, functional medicine testing, sometimes urine testing, sometimes stool testing, and we really want to identify where these symptoms are coming from. And our goal is not to mask symptoms. So for instance, if you are having low energy, we need to have a look at the body as a whole. Is this coming from a nutrient deficiency? And if you have a nutrient deficiency, why is that? Is it a lack of dietary intake? Is it a concern with absorption? Is there something going on in the gut health that we need to have a look at? Instead of just saying, okay, hey, take B12 and iron and vitamin D. Yes, sometimes we need to utilize those things, but if you can get them from dietary sources, we need to ensure that the nutrition is important. So we do a lot of nutrition in my practice. I've created the Metabolic Reset Program, a program designed to help individuals with resistant weight loss. And sometimes we use medication, sometimes we use supplementation, sometimes we use hormone replacement therapy. I do work collaboratively with a variety of different professionals where our goal is to provide you with all of your treatment options. So we'll say, okay, based off of your blood work, here's what's going on, and here are all of your options. And then you get to make the informed choice, whether it's a supplement or a medication or a dietary change, on what feels right for you. And then, of course, we want to repeat that testing, usually in about 3 months, to ensure that we're on the right track. All right, so I'm going to start talking about what insulin resistance is and what are some of the signs and symptoms, what are some of the things that you can do, and then we'll get to the questions too. There's a really great question on Manjaro there that I'm happy to go through. So we do know that insulin resistance is a really prevalent condition. It is estimated between 1 in 2 individuals in North America are suffering with this, anywhere from 1 in 2, 1 in 3, depending on what statistics you look at. Now, insulin resistance is a condition that occurs prior to being diagnosed with type 2 diabetes. We can see insulin resistance anywhere from 14 years before the hemoglobin A1C or your average blood sugar actually goes up. So this is where individuals are really suffering with symptoms and their blood work comes back normal and they're told, nope, your blood sugar is fine, just deal with these symptoms. Or sometimes they're given, most commonly, an antidepressant, or they're given hormone-based birth control without really looking at the underlying issues. Now, insulin resistance, we can pick up on blood work. So as long as you have the comprehensive testing done, you have your blood sugar markers, but you also have a fasting insulin, and we look at your cholesterol panel. In fact, there's a website called The Blood Code that I've posted a number of times. I'm happy to post it again, where if you have a basic cholesterol panel, you can actually plug in your triglyceride levels and your HDL levels to get an idea of whether or not insulin resistance is impacting you. But if you have resistant weight loss, especially weight gain around the midsection, or your liver enzymes are starting to go up, or your hemoglobin A1C anywhere above 5.5, I'm really starting to look at insulin resistance. You could have fatigue. We can see changes to the skin. So we can see a darkening around the neck. We can see skin tags, acne, oily skin. We can see hair loss on the head associated with insulin resistance as well. Food cravings or always feeling hungry. For women, we might see irregular periods or infertility. We might see erectile dysfunction in men, depression, anxiety. All of these symptoms can be associated with insulin resistance. And the way I think about this is if your blood sugar is higher, and that's going all the way through your body, that definitely can impact a lot of your organ systems. So when I'm looking at how can I make the most changes in a patient's overall health, how can we prevent things like certain types of cancer, heart attack and stroke, Alzheimer's, dementia, it really comes down to making sure that the blood sugar is within the optimal range, and most importantly, the insulin is not too high. So when you consume carbohydrates, perhaps they're healthy carbohydrates like fruits and vegetables, or they're unhealthy carbohydrates like breads and pastas. It doesn't necessarily matter. Anything with carbohydrates is going to be broken down and digested by the body, and your blood sugar is going to go up. Okay, so that's healthy and normal. Now, what should happen is when your blood sugar rises, it tells your pancreas to make insulin. This is normal. When your insulin goes up, the role of that is to help get the sugar from your bloodstream into the cells. We need the sugar to get into the cells so that you can have good energy, so you can burn the foods that you eat for energy or ATP. You need it for your muscles. Your body, you need to get the sugar into the cells. If that happens, everything is great. Your weight is maintained, your energy is good, you feel good. Now, in insulin resistance, what happens is the sugar can't really get into the cells. It still does to a degree, but it's not as efficient. So the blood sugar rises and your body makes more insulin. If it doesn't go into the cells, your body's going to make more insulin and more insulin and more insulin. And this elevation in insulin is really what's creating the symptoms. This is what's elevating the cholesterol. This is what is causing your low energy. Your cells are starving. Your cells are not getting the glucose. And when insulin rises, it tells the body, hey, like, we can't keep the sugar in the bloodstream. That would be damaging to the eyes, the kidneys, your nerves. That's what we call type 2 diabetes. The blood sugar is rising. What the heck are we going to do? If we can't get it into the cells, insulin says, still hear me? Did I lose connection there? I feel like this is going to be a weird pause, but my phone just said lost connection. I'll just keep going. We want to know not only where your blood sugar is, but also how hard is the body working, or how much insulin is the body producing to keep your blood sugar under control. So if you've gotten the check mark that your blood sugar is great, that's fantastic. Okay, we're back, thank you. Perhaps your blood sugar is great, but what if your body is producing 3 times the amount of insulin to keep it under control? That's not ideal either. Okay, so we need to know your blood sugar, but we also need to know the insulin. This is really important to establish whether or not insulin resistance is present. So essentially, it's not that carbohydrates are necessarily an issue. It's the hormone-related response that your body is producing that's the problem. So what we can have a look at is, what can we do from a dietary perspective? What can we do from a medication or supplement perspective to fix it so that glucose can get into the cells? If your glucose can get into the cells and your carbohydrates, you can burn them for energy, then you can consume more carbohydrates. Of course, we're looking at healthy whole food carbohydrates. We don't necessarily want you to consume, processed sugars, of course, but if we can fix this mechanism, you're going to have a lot more metabolic flexibility, meaning that some days you can consume higher carbohydrates and some days perhaps are lower. So what we do in my practice is I like to run the comprehensive blood work to see where the insulin levels are. Then we can decide, okay, what is appropriate for you at this particular instance for the amount of carbohydrates that your body can tolerate. Perhaps during the first 6 weeks, we're looking at reducing the carbohydrates, and then we can cycle them back in depending on where your insulin levels go after that 3-month time period. It can be really challenging to stick with a lower carbohydrate diet, or it can be particularly challenging to stick with a really restrictive intermittent fasting routine. Those tools can be really helpful for some individuals at the start, and they're tools that I often recommend and utilize. In the Reset program, we definitely do the intermittent fasting. We do a lower carbohydrate approach. We're removing the processed foods and the alcohol, but we have an exit plan. So after the 6 weeks, we walk you through a maintenance phase where we teach you how to add carbohydrates back in, and we decide how much your body can tolerate at this point in time based off of your goals. And we can also look at what is reasonable for each individual. So I think in conventional medicine, we have this, if this, then do that. Everybody's the same, everybody's treated the same, which is really not the way it should be, because each individual is unique, right? So if you really want to have breads in your diet, then we need to figure out how can we fit that in for you. Is there a bread alternative that perhaps is lower in carbohydrates, like a carbonate bread, if you still have insulin resistance? Or when do we know how much carbohydrates you can tolerate? So it's really an individualized approach where we can work with you to say, here's your numbers, here's your nutrition plan, here's your exit strategy. Because if it doesn't feel sustainable and maintainable, then the problem is that weight gain will come back. So that maintenance piece is something that I'm really passionate about and something that's non-negotiable for anybody that works with us through the Reset program. You have to do the maintenance plan. So we have to teach you how to maintain this. If you are experiencing cravings and higher appetite, this can be due to the insulin resistance as well, because your body is truly starving. You are not getting enough of that glucose into your cells to sustain that. It's all going away to storage. And what we find in the question with Mounjaro are things like Ozempic, Saxenda, Ribellis, the semaglutide-based medications in general. The reason that those are helping is because they're helping with the underlying insulin resistance. They're helping with that lock and key mechanism so that your body has a better hormone response to the sugars that you eat. Now, one of the things that Ozempic, Saxenda, Ribellis, Mounjaro, these medications help to control appetite. And they do that in 1 to 2 mechanisms. One, directly, they reduce the appetite, but also when your body's able to utilize carbohydrates for energy and you're able to tap into your own stored body fat, you're not going to be as hungry. So if anybody is looking at, okay, I want to fix my appetite, or I'm feeling like I'm really hungry, what's going on? The way these GLP-1 or the way these semaglutide-based medications are working is they're stimulating GLP-1. You can do that on your own with diet and lifestyle by making sure that you consume enough amino acids. So amino acids actually do stimulate GLP-1 and can help with appetite too. So this looks like, and you've probably always heard it, get enough protein in your diet. Protein, protein, protein is key. Now, if you are on one of these types of medications, one of our concerns is the weight goes down, but you're tapping into your protein stores, you're tapping into your lean muscle. So it's really important when you're on these medications, or even if you're not on these medications, to get enough protein, protect that lean muscle. Now, if protein is a challenge for you, this is where we have all this research. It's really great to consume protein, but if it's not realistic to fit into your lifestyle, we can look at supplementation with amino acids. So for a lot of the individuals that I work with, we're using supplemental-based amino acid powders. Food is always first, food is always best. But again, looking at the busy lifestyles, I recognize that there's some instances where this is not always possible. So if I'm having a meal where I'm like, ooh, I really didn't have enough protein there, I'm not feeling like a protein shake, or I look at my overall day and say, wow, I really didn't get enough protein, then supplementing with amino acids is something that I utilize. All right. I'm just going to go through some of these comments. Some of the medications like ephedramine that just suppresses your appetite, I'm not a huge fan of those, because what's going to happen when you stop that medication? Yes, if your appetite is better under control, you have more control over your nutrition, you can fix your insulin resistance that way, but I really like to get to the root cause if at all possible. Now, from a dietary standpoint, if your blood sugar is higher, if you have insulin resistance, not adding more sugar into your diet is going to be key. So eliminate the processed things first. The white sugars, the added sugars, the processed foods, the packaged foods. Have a look at, how much fruit are you consuming. I don't mind approximately 4 ounces of fruit at 2 meals when they're paired with proteins and fibers. And that's not the end of the world. But when you're consuming a high amount of fruit on its own, that's where you're going to get a larger insulin spike. So if you are just consuming carbohydrates, if it's a really simple carbohydrate, always try to pair that with protein and fiber. So I use this approach where you want to have half your plate of vegetables. That's going to be a really good dose of fiber. A diversity of vegetables is really important for your gut microbiome. Follow that up with a quarter of your protein, or a quarter of your plate being protein, and then save the carbohydrates for after. So if you are having things like rice, breads, pastas, beans, legumes, anything with a higher carbohydrate count, try to make that about half to 2/3 the size of your protein. Okay, all right. In addition, when we're looking at supplemental strategies that you can utilize to help with insulin resistance, so we talked about a lower carbohydrate approach, but we also have to say, okay, why is the body not tolerating the carbohydrates? Where did this insulin resistance come from? Some individuals absolutely have a genetic predisposition to insulin resistance. They have a strong family history of type 2 diabetes, or maybe PCOS runs in your family, or perhaps obesity in general, high cholesterol. If you have that genetic predisposition, it doesn't mean that you're destined to have these related concerns. You can change the way your genes are expressed through diet and lifestyle. So for some, a lower carbohydrate diet, intermittent fasting, consuming larger meals but less often is particularly helpful. If that is still not working for you, if you are incorporating some resistance training, walking post meals, you're doing all the right things, you're sleeping, you're managing your stress, then we may need to look at what are some other contributing factors. We do know that wrong types of gut bacteria can increase the risk of insulin resistance. If you don't have enough of a key bacteria called Akkermansia, that can make it harder, or we see an association with more metabolic concerns. Nutrient deficiencies like low iron, low vitamin D, selenium, zinc, these are all really important for managing your blood sugar as well. If you have really high or low levels of iron, that can be a contributing factor. Lack of sleep is a huge one, so if you're not sleeping, we have to figure that out. And we also know that when hormones begin to change in both men and women, that can make it harder for you to manage your blood sugar as well. So in males, what we often see is a testosterone deficiency. If you're deficient in testosterone, you are going to have a harder time managing your blood sugar. And if you have insulin resistance, we can see that associated with lower testosterone as well. So it's kind of the chicken and the egg conversation. Both seem to impact. So you need good hormones and lack of insulin resistance to really help both manage. In women, when women go through perimenopause and menopause and we start to see the decline in both progesterone and estrogen, you are not as resilient to the changes in your blood sugar. You are not as resilient to the changes in your stress. For women with PCOS, we often see a lack of ovulation. And if you don't ovulate, you're not getting that rise in progesterone. That actual ovulation and the rise in progesterone really does boost your metabolism for those 2 weeks. So if you're not getting that, you're not benefiting from that overall month after month. Okay, other things that you want to have a look at. You want to have a look at your hormones, you want to have a look at your thyroid, you want to have a look at obviously the blood sugar management, your lipid panel. Really a good comprehensive test can allow us to say there's not one thing that's contributing to insulin resistance, but we can really have a look at it and say, okay, you're vitamin D deficient, let's fix that. Your cortisol, your stress hormones high, how are we going to work on that? Your hormones are not optimal, how are we going to fix that? Because looking at the body as a whole and working on those key aspects can really help manage your blood sugar over time. So the question about insulin resistance in terms of the symptoms, low energy, resistant weight loss, elevated liver enzymes, fatty liver, mood changes, infertility, erectile dysfunction in men, low testosterone, all of these things have been associated with insulin resistance. Even having an elevated waist circumference, having a BMI of over 30, all of that points to insulin resistance as well. So the key thing is to look at diet and lifestyle first. It is harder to stick with a low carbohydrate nutrition plan when you have insulin resistance because your appetite is really high and your food cravings are higher. So what we look at is, okay, how can we manage that so it's easier for you to stick to a whole foods, lower carbohydrate nutrition approach? And then at what time do we know that we can cycle out of that? So things like berberine. Berberine is a herbal-based product that has been shown to support insulin resistance, improve insulin sensitivity, can help with elevated liver enzymes, can help with cholesterol. That is a great option for some individuals. Metformin is a pharmaceutical medication. It does have a long-term safety study called the TAME study. It was a 30-year study showing reductions in risk of Alzheimer's, cardiovascular disease, dementia, certain types of cancers. That was a really great study that was done. That perhaps could be something that's utilized for individuals long-term because we know it's safe. We do know that the berberine is equally as efficacious in terms of its way to manage the blood sugar as metformin, but there's not going to be as much funding and different studies done on the herbal-based products, just the way the world works. So if you're looking at, okay, I've got this under control with diet and lifestyle, what am I going to do to help maintain it if I do have that genetic predisposition? Perhaps something like that could be helpful. Inositol is a really great one for managing your blood sugar. It has some great evidence in PCOS. It also helps with the stress and mental health component of it. If you are finding that the stress is a contributing factor to your eating habits or your cravings, really looking at getting enough of the amino acids and the proteins and the meditation and the sleep, really, really important. Side effects of berberine could include upset stomach, gas, bloating, diarrhea, but it's usually very mild and it typically does resolve on its own. Now, it's interesting when we look at the mechanism of action of berberine and metformin, both of those do appear to create favorable shifts in the gut microbiome. And the gut microbiome is really important because it dictates the amount of calories that you absorb from the foods you eat. So a particular type of probiotic called Bifidobacterium B420 after 5 months of use has actually been shown to result in weight loss independent of any changes with diet and exercise. And this was actually a human study, which I find quite fascinating. So looking at, okay, does everybody need a probiotic? No, not necessarily. But if you are deficient in that bacteria, it could be helpful for you. We also want to encourage a healthy whole foods diet with a diversity of vegetables, because that's really how you get a really good, diverse gut microbiome. There's questions here, I'm getting all confused. The semaglutide-based medications can also be helpful. The semaglutide-based medications do carry some risks. We do see them as positive impacts on weight, yes, but what we want to do is always, always, always focus on diet and lifestyle when you're using any sort of intervention, because we want to make sure that that weight does not come back. My concern with the semaglutides, of course, the risk factors of certain types of thyroid-related tumors, that was really only in a rat study. In addition, it was specific to individuals who had a strong family history of thyroid cancer, specifically related to men too. So you want to speak to your practitioner to evaluate what your unique risk is with that. If you're using high doses of these types of medications long term, there is the risk of pancreatitis as well. So it's really important, like the medications or supplements, they're not a way to just use something so that you don't have to work on your diet and lifestyle. That's not going to be a good treatment approach, and you're definitely not going to feel well if you do that. So looking at, okay, how can I use this as a tool to help manage my appetite and speed up my results, and then how am I going to maintain it? So with the semaglutides, at least in our practice here, we're using them short term, and then we're looking at a long-term strategy with diet, lifestyle, maybe metformin, or maybe inositol or berberine or something like that. If you're looking for an appointment, I think the best way would probably be to email my office or send a text or a call to my office too. We can help with that. Testing for insulin resistance, I like to run a fasting insulin. There is another test called a 2-hour oral glucose insulin challenge test. Essentially, you go into the lab, you're fasted, you do your blood work. You drink this not so delicious drink of 75 grams of glucose, and then we monitor your glucose and insulin 30 minutes, 60 minutes, and then 2 hours. That test is time consuming. It's more invasive because it requires multiple blood draws. You don't have to do that test. A fasting insulin is all I really need to have a look at. Fasting insulin, your signs and symptoms. But again, right, we talked about how nutrient deficiencies can impact your blood sugar, and how your hormones can impact your blood sugar, and how your cortisol can impact your blood sugar. So I really like to run a comprehensive test. So I have a look at everything all in one. There is a wholesale-based lab company called Rupa Health that I think is fantastic. They have really great prices. Their customer service is really good. I have linked in my bio on TikTok and on Instagram the testing that I run. I've listed them all out to say, here's the comprehensive blood work for females, comprehensive blood work for males. If a female is on a hormone-based form of birth control, I don't personally monitor the hormones, because we know the hormones are going to be showing that you're just on birth control. So there's a panel for individuals who are on birth control versus not. And you can order that on your own. And if you want to set up an appointment with me to review each step by step, I'm happy to do that. Side effects of inositol. Some individuals can feel digestive upset. It really depends on the dose and when you're taking them. So sometimes playing around with the dose and taking it more with meals can be helpful. If you're having a hard time getting in contact with my office, can you send me a message on Instagram? I have the comments turned on there, or the direct messages on there. Send me your contact information. I'll make sure that they reach out. Sometimes our emails do go into spam. That's a factor too. All right, so the blood work we talked about, you can order that through Rupa Health if you're in the US. If you are in Canada, we can order blood work, or I can order blood work for you. I'm licensed in Ontario and Saskatchewan. If you are looking for a referral for somebody in another province, I can maybe help with that as well, depending on what your signs and symptoms are. In terms of the blood work, if your physician is saying that your blood work's all normal, I would really want to have a look at, was enough testing run, and are those normal results truly within the optimal range, or perhaps something was missed. If you don't feel well, then we need to honor the fact that you're not feeling well and something is off, and we need to dive a little bit deeper until we figure it out. Hair growth. So if you are experiencing hair loss, it can be from a variety of factors. Iron deficiency, vitamin D deficiency can cause it. High cortisol can cause it. A thyroid-related concern can cause hair loss. Having elevations in quote-unquote male hormones like DHEA or DHT or testosterone can also cause hair loss as well. So it all depends on what exactly is the cause for you. So instead of just looking at, okay, I'm going to take this hair, skin, and nail gummy vitamin, which may or may not have really good dosages in it, you need to figure out what is the cause. And if we can figure out what the cause is, then we can look at providing you with the appropriate treatment. In terms of the hormone testing, if you are a cycling female and you still have a menstrual cycle, it's really important that you do the blood work, ideally 7 to 10 days before your next expected menstrual cycle. And we need to always journal and track where your cycles are, because we need to interpret those blood work based off of where you were in your cycle. So it's important 7 to 10 days before your cycle to do it. Anytime you're doing blood work, as a general rule, I recommend going in fasting, ideally first thing in the morning is what I tell my patients, because most times I am running insulin, fasting glucose. A thyroid-based panel should be done in the morning as well. There is some research to support if you test later on in the day, hypothyroidism or low thyroid can be missed. So it's important always first thing in the morning to utilize that, or to do that testing. We also know that biotin, which is a type of B vitamin often used for hair growth, if you take biotin 2 days before you do your thyroid panel, you could change the results of that testing. So fasting first thing in the morning, no biotin 2 days before you go in. Metformin can cause those GI side effects, and in about 5% of individuals, they can just not tolerate metformin. So if that is the case for you, there may be some other options to have a look at. If you are having digestive complaints, one of the things that I often like to run is a comprehensive stool test to see what's going on. So the testing that I often use in my office is the GI map or the Genova-based testing to have a look at the gut microbiome, and we can make favorable changes based off of that testing, right? So if you have bacterial overgrowth, maybe we need to use antimicrobials. If you have H. pylori, which I'm seeing more and more commonly this year, we need to treat that. H. pylori is a bacteria that lives in the stomach and can prevent you from absorbing your vitamins and minerals. We can also see heartburn. We can see kind of a chronic tickle in your throat. H. pylori has been associated with elevated thyroid antibodies as well. So when we look at autoimmune conditions or thyroid-related concerns like Hashimoto's and Graves', we know that a lot of our immune system lives in the gut. And the gut is really important for even converting your inactive thyroid hormone to your active one. So looking at gut health is particularly important. $700 for blood work in Canada. You know, it's really interesting. You can go to the US and get a full thyroid panel. You can go to the US and get full comprehensive blood work done. And I think, like, I run a ton of testing, and the full comprehensive panel is roughly around $300. So it's quite interesting or why the lab testing is so expensive in Canada. I really don't understand it. In Canada, we can run some of the blood work under OHIP. If you're in Ontario, that could be an option for you if that's where you're located. But yes, I can definitely set up an appointment to review that with you. Anti-TPO is a thyroid antibody. There are other types of thyroid antibodies as well. So what this tells us, if you have elevated thyroid antibodies, that your immune system is mounting an attack on your thyroid gland. There is a small percentage of individuals who have elevated thyroid antibodies, and it doesn't cause them any concern. It doesn't cause them any symptoms. It doesn't mean that they're going to need a thyroid-based medication in the future. But we also know that individuals who have elevated thyroid antibodies could in fact develop hypothyroidism or hyperthyroidism in the past, or some sort of thyroid-related concern. So you definitely, if you have those antibodies, want to be monitored really closely to see. You may be warranted or needed to do a thyroid ultrasound to see what's going on. Again, in my practice, we tend to do more just for peace of mind and for monitoring and to see what's going on. And you also want to have a look at what is triggering the immune system to mount an attack on your thyroid, right? Is there food sensitivities? Sometimes it's related to celiac or non-celiac gluten sensitivity. For some individuals, it's dairy. For some, it's eggs. You don't have to remove everything, but we need to figure out, is there something there that's impacting you? We also know that gut infections like small intestinal bacterial overgrowth, as well as H. pylori, sometimes can trigger the immune system in such a way where those antibodies go higher. I do have on my YouTube channel, I know it's hard, I'm a visual learner, so some of these concepts are hard to understand without pictures. So I do have a thyroid presentation on my YouTube, I have a hormone presentation, I have a blood work presentation, I have an insulin resistance presentation, that goes through all of the pictures, the testing, the signs and symptoms, and different treatment options. If you had gestational diabetes in pregnancy, yeah, we can see that associated with more risk of insulin resistance in the future. Again, it's really important. You can have normal blood sugar, you can have normal hemoglobin A1C and still have insulin resistance. That's why you need to have that fasting insulin marker run. The continuous blood glucose monitors that you put on the back of your arm, those monitor your blood sugar. So while they can be helpful for some individuals to recognize what foods or how sleep impacts your blood sugar or how stress impacts your blood sugar, how exercise impacts your blood sugar, it can be a helpful tool to see, okay, if I eat this and my blood sugar goes really high, then we know you need to make a change. And it's nice that it's real-time feedback. But even if you do that continuous blood glucose monitor and everything stays within the healthy range, that doesn't necessarily exclude insulin resistance because it's monitoring your sugar. What if you're producing 3 times the amount of insulin that's optimal and your insulin's staying really high for hours and hours? That's going to be a problem, okay? If you have insulin resistance and you need some ideas in terms of how do you manage that, we covered a lot in this presentation today. Maybe check out the insulin resistance presentation on my YouTube channel. It talks about diet, lifestyle, supplements to consider, medications that you could consider, and then you can take that education and that information and have a conversation with your doctor in your area or set up a one-on-one appointment with myself or somebody else who practices functional medicine, and they can help you understand it. I find that individuals are just not getting the education. They're not getting the understanding. They're not talking enough about their nutrition and the impacts of lifestyle. And then sometimes they go away from their doctor's appointment, perhaps with a prescription, but they're really confused, right? So if you have a prescription and you want to talk more about that, definitely I'm happy to consult with you about that. If you have insulin resistance, it's more challenging to lose weight because that lock and key mechanism is a problem. Even if we look at, humans or rats, if we inject a rat with insulin, they don't change their diet and lifestyle, they are going to put on weight. So we do know that elevated levels of insulin are a particular problem. Elevated levels of insulin can raise your cholesterol. It can really mess with your hormones in both males and females. In males, we can see lowering of testosterone. In females, we can actually see rising of testosterone in the lack of ovulation. If you don't ovulate, you don't get your progesterone, and then it's a whole host of other things. So these are complex topics, and that's why I like to spend an hour to an hour and a half with patients so that I can show you these pictures and I can explain it to you so that you have a deeper understanding and you really feel that you've been given informed consent. Now, for individuals asking about the optimal levels of insulin, it does depend on what units of measure you're using. So for somebody who is Canadian, I'm looking at really a fasting insulin of 20 to 40. For individuals in the US, around 4 would be appropriate, but it depends on your symptoms too. So this is where holistic medicine and individualized medicine is really important, because if I have an individual who has a fasting insulin of 68 and their weight's maintained, their energy's really good, their hormones are great, their nutrient levels are great, then there's no need to initiate a treatment plan. Everything is looking really good. So what is going to be optimal? It's going to be a range, and it really does depend on your symptoms. So typically I am looking at doing an initial consult with somebody. We're speaking for an hour to an hour and a half. We are really reviewing how you feel, your signs and symptoms, what's going on with your nutrition, your gut health, your sleep, your mindset, like looking at everything. Then we can more precisely say, okay, here are the labs that we want to run specifically for you. I try to give as much information and education to everybody on here as possible. So I have listed in the link in my bio, here's the testing I typically run. But for some individuals, maybe they have really significant joint pain and they have a family history of autoimmunity. Maybe we want to add on some autoimmune testing and specifically testing for rheumatoid arthritis. So initial appointment is always going to be first. We establish what needs to be run. Then we run the blood work and we review it. And then we have a look at, in 3 months' time, after we've initiated a treatment plan, is our treatment plan working? So if your doctor has told you have low vitamin D or you have low iron, just take some, and they're not giving you the dosaging, they're not telling you how long, and they're not repeating the blood work to know if it's even improving, that's a problem, right? So yes, iron is important for individuals. It plays a really crucial role for your energy, your metabolism, dopamine, your motivation hormone. Iron's really, really underappreciated. It is important, but we need to make sure that we give you enough of a dose of iron, and then we know when to come off of it. And furthermore, we need to figure out, why is your iron low, right? So is your iron low because you're not absorbing it? What's going on in the gut? Is your iron low because your periods are really heavy? What's going on there? Where are your hormones? How do we fix that? The insulin test is called a fasting insulin. And you could also run a fasting glucose, the hemoglobin A1C. Adiponectin is another one that's associated with insulin resistance. All of those panels are within the link, so you can have a look there. The presentations, I would recommend checking those out because it goes in a lot more detail. It's slower. You can see pictures. I'm personally a visual learner, so if I was listening on here, I would have a really hard time. So I hope that was helpful for you. I'm going to pop off. If there is anything that you have specific questions on or recommendations for more live videos, please let me know, or post in some of the comment sections of the videos that I post on TikTok. You can message me on Instagram, follow me over there. On Instagram, it's nice because I can type out things too so that you can read it and save it. And I'm hoping to hop on more to do more of these lives as well too. And you can always message my office if you want to set up a one-on-one appointment with me to get your blood work done, to review those labs and come up with a plan. And the presentations are on YouTube. So within my bio on TikTok, you can find them, or search my name on YouTube. They are longer, but maybe put it on as a podcast, or watch it in pieces. Sometimes I ramble on a little bit more, but I hope that was helpful for you. If there's anything specific, let me know. And I don't have recommendations for COVID. I really stay clear away from COVID conversations. I find that's just easier. So sorry about that. You might want to speak to your primary care or somebody else who is more focused on that. So I hope that was helpful. We'll talk soon.